Are you struggling with arthritis, or maybe you think it's time to start looking into a knee replacement? Two of the newest hip and knee orthopedic surgeons at Trinity Health are here today to share some insight about when it might be a time to visit with an expert. Welcome to Dr. Kevin Steelman on the end and Dr. Jeff Cross. Gentlemen, thanks so much for being here.
Thanks for having us.
Wonderful. And so let's start with arthritis. Super common. Let's talk about what it actually is and how someone might know that they're suffering from it.
Yeah, it's a great place to start. So when we think about a joint, any joint in the body, it's where two bones meet. And where they meet, there's typically some cartilage on the ends that allow the joint to move smoothly. In people with arthritis, that cartilage starts to break down and the joint becomes stiff and painful. For most people, this just happens with age and normal wear, kind of like treads coming off of a tire, right? But in some people, it can happen from bad alignment, conditions like rheumatoid arthritis, where the body attacks its own cartilage, or a prior injury. Unfortunately, there's no good way to put that tread back on the tire. So people typically have pain, swelling. Sometimes people with knee arthritis can have some redness. People with hip arthritis will have trouble putting on their socks.
Okay. All right. So what can a patient do if they're suffering from this? There are kind of a few different things. Let's talk about what they can do.
Yeah, there's quite a few things you can do. And if patients come in to see myself or Dr. Cross, we always try to start without doing surgery.
Sure.
Yeah, so the few things we like to try first and foremost is exercise. It's important to keep moving, and that can be hard when you have a painful knee or hip, but any little bit that you can do helps. Second, we also like to try medications such as anti-inflammatories, and you can do mostly over-the-counter stuff, so ibuprofen, Tylenol, things like that. But we can also do prescription strength anti-inflammatories, which last a little bit longer. And then finally, we'll also try injections. I know nobody likes to get shots, but what we'll usually try is steroid shots. Those have been shown to work pretty well. Usually we do those in knees. You can also do them in the hip as well. And then another variation of that is what we call hyaluronic acid injections. Some people call it chicken fat injections. And the idea behind that is basically to lubricate the inside of the joint. It's kind of like spraying cooking spray on a pan that's lost its Teflon.
Okay, perfect. Yeah. So yeah, I love that, the non-surgical options. But if this becomes painful enough and none of those are working, then, you know, there is the surgery option. So let's talk about that and how this has kind of changed for people.
Yeah, absolutely. And, you know, once we've kind of exhausted those non-surgical options, then we start having the conversation about doing a joint replacement. And during the surgery, we remove those kind of worn out parts of the bone on both sides. We replace them with metal and plastic that's kind of specifically sized to each patient. And then that joint will now move typically just like the old joint did, but now smoothly and pain-free. You know, the technology has gotten a lot better in recent years. About over 1 million joint replacements are done every year in the United States. It's very routine, it's very safe, and very effective.
Yeah, and let's talk about some of the technology, because I think that, you know, if people haven't talked about someone, you know, just talked with someone who's had a joint replacement more recently, you know, it would lay you up for a bit, and it would be pretty invasive. And these days, it's a lot easier.
Yeah, there's been a lot of innovation in our field over the last few years. More recently, there's been a push to do hip replacement surgery from the front, what we call a direct anterior hip replacement, as opposed to what was historically done, putting it in from the side or the back. And this can be really helpful, especially as a lot of these procedures are done on an outpatient basis and people want to go home. And the direct anterior hip replacement can help with that because you are going between the muscles and not through, and it can offer a little bit more of early recovery. Wow. Other innovations are with the actual implants themselves. The plastic that goes between the joint we put in is much more durable and lasts much longer, up to 30 years or so. And then what I'm most excited about is robotics and technology. So I was trained, and Dr. Cross was trained in using robotics and joint replacement surgery, and I'm really excited to say that Trinity is going to be offering this technology to its patients. It's a really powerful tool, and I'm really excited about it.
Yeah, it's pretty fun to watch, actually, you know. And so besides, you know, having all of that technology, why should a patient choose to come see you guys in orthopedics at Trinity?
Yeah, absolutely. I worked with the surgeons at St. Mary's when I was a medical student. Had a lot of respect for the way they kind of cared for their patients. It was very patient-centered. They were kind of focused on high-quality care. And Trinity has kind of aligned itself well with those goals. It's nice to come back and see them offering a lot of flexibility and resources to us to be able to do that for our community. So I'm very excited to be a part of that.
Yeah. And for me, this is home. I grew up here in Grand Rapids, went to high school just up the road here at Northview High School. And I'm just really honored and proud to be able to come back to town here and take care of the patients and community that I care about so much.
Well, we're happy to have you both. And there's an opportunity for learning as well for patients. Let's talk quickly about that.
Yeah, absolutely. On September 18th, we'll be having a Wednesday wellness webinar, and I'll be talking a little bit more in depth about hip arthritis and the things that we can offer you here at Trinity.
Wonderful. And you know, obviously being proactive, you know, you're talking, if someone's dealing with pain, the exercise maybe not the thing they're thinking about. Any advice quickly as to how people can try to prolong things without having to have surgery themselves?
Yeah, basically what I was saying before, there's, you know, more exercise, physical therapy, directed exercise, that can be really helpful to help strengthen the muscles around those painful joints. There's a lot of other alternative things, acupuncture, alternative medicine. I like to say, if it helps, and we'll just keep doing that. We'll always be here for you for surgery when the time comes.
There you go.
Yeah.
I appreciate it. Well, thank you, gentlemen, so much for being here. We really, really appreciate it.
Yeah,
you want to learn more? TrinityHealthMichigan.org/ortho. You can sign up for that wellness series coming up on the 18th. You can also call that number on your screen, 616-465-5910. We'll be right back.